Hundreds of protesters have taken to the streets in Kenya, furious over plans for a US-run Ebola quarantine facility. Demonstrators are demanding the centre be scrapped, with fears the deadly virus could spread beyond outbreak zones.
Why do Americans think that their lives are more important than the lives of Kenyans? That appears to be the national mood here, the overall sentiment across the country. There is near universal opposition to this US plan to set up an Ebola quarantine facility or isolation ward in the country for Americans. The Law Society of Kenya has also filed a constitutional petition to essentially block the Kenyan government from doing this because, again, the same argument is that if Ebola is too dangerous for Americans, it is too dangerous for Kenyans. The Kenya Medical Practitioners and Dentists Union, that is the union representing 10,000 plus doctors in public and private hospitals, are opposed to it. They say that Kenya is a sovereign nation. It is not a geopolitical isolation ward, and that they will not allow the Kenyan government to give up public safety for foreign aid. That reference is because the U.S. has said it is committing $13.5 million to Kenya for Ebola preparedness efforts. Many Kenyans are offended by repeated statements from U.S. Secretary of State Marco Rubio. He said that the U.S. priority is to protect U.S. citizens and that they will do everything to ensure that Ebola does not get to the U.S. The corollary here, the way people see it here in Kenya, is that they're saying, oh, you can have Ebola over there in Kenya, but it cannot come to the U.S. even if they're American citizens. But the Kenyan government has not been fully transparent in terms of what deal they got into with the Americans. So far, there's been no response from the Kenyan government, and that is fueling a lot of speculation as to why President William Ruto's government got into this deal in the first place. And some Kenyans say it appears to be for the money, and they say return the money to the Americans and keep us safe, because they feel that the Kenyan health system, the healthcare infrastructure here is just not ready for an infectious virus like Ebola.
They cannot do that because the Americans, they are so very selfish. They say this is an institution or it's a quarantine facility for only the Americans. So the Americans are selfish to the core. And we have to tell Americans to get off our noses business. Get off our get off our skin.
We want to tell the president he cannot be making such a decision to people of Kenya without even considering what will be the effect of what they are doing. We reject with the strongest terms the building of quarantine facility in Laikipia County.
We do not have any history of Ebola here. Why are they not doing it in the DRC? Why are they not doing it in Uganda? Why must they bring it here? So we are saying we categorically, no negotiations, no public participation, we want nothing. We want that facility taken out of our town. We want it taken out of Kenya.
I'm sorry, Kenya, but why are you surprised that your country is being used as a quarantine station for Americans that contracted Ebola, so that they can get sick in your country and not bring it over to theirs? And that is because your president, President Ruto, signed the America First healthcare strategy in 2025, and it's just like how it sounds. America first, Kenya second, if even that. And in that deal, it included all of your healthcare data. Meaning if you go to the hospital with a cough or a hiccup, then some guy in an office in America will know before your own family does. All of your healthcare data is completely in their disposal. And that is the deal that your President Ruto has signed onto. Now, it was held in court. I mean, it was being disputed for a while in court. But that finally gave way, and now it is being implemented. And the first signs of this is this mega quarantine happening in your country. It's really sad what is happening in Kenya right now. But it's not the only African country that signed this ridiculous America First healthcare plan, as if their own citizens are supposed to accept that they are second. And these are all of the African countries that have signed this America First healthcare plan. So I wouldn't be surprised if these quarantines start showing up in other parts of Africa.
People here in the country feel that the government is trying to import Ebola here because the U.S. has given Kenya money to do that. And that is at the heart of this problem. We understand, according to CNN source, that the first Americans who will man this Ebola containment facility arrived Saturday. The HHS has previously told CNN that they're sending a specialized team from the Public Health Service Commission Corps. We're talking physicians, nurses, lab technologists, mental health practitioners, and engineers to care for the Americans that will be exposed to Ebola and sent to this facility in Kenya. A high court here in Kenya put an injunction against it temporarily until this case plays out in court. The reasoning is that this could endanger public health. And the other question from Kenyans is, why is this specifically for Americans and not other citizens?
Kenya just told the United States, hell to the no, y'all not about to bring Ebola across our borders. What are you talking about? You setting up a state-of-the-art facility, quarantine, just for Americans that's affected with Ebola or been exposed by, exposed to Ebola. They was like, nobody's crossing our borders temporary for now, because they're trying to figure out how is this going to benefit Kenya. And I kind of agree with Kenya, because Kenya, they don't have any cases out there of Ebola out there. All African countries need to do what Kenya's doing. Close your borders, until this stuff get contained, because it's spreading rapidly. But as for now, they're just trying to work it out. How is this going to benefit Kenya? And especially if the facility is only for Americans, to treat Americans. So you're going to treat Americans, bring that to our, country, and then bounce.
Say no to Ebola! Say no to Ebola!
Protesters brought a casket with the word Ebola written on top to the Kenyan Health Ministry's doorstep. It's symbolic, but people here are concerned that the government could allow the virus into the country, which has no cases so far. It's all because of plans to establish an Ebola quarantine and treatment center for Americans at the Laikipia Air Base in central Kenya. On Monday, protests there got violent. People don't want that facility anywhere near them.
What the American government is doing is to work with us in partnership to build the capacity to make sure that if ever we needed a facility, that facility will be there to serve the people of Kenya and to serve our friends, including the Americans.
On Tuesday, a Kenyan court blocked the proposed facility for a second time for 3 weeks. The next hearing will be June 23rd.
On Ebola, if Kenya does end up blocking the U.S. quarantine facility there, and it seems like they might since the Kenyan courts are delaying it, where will Americans who have been exposed end up going? And then why can't they just come to the United States? I mean, I think you would probably agree that the U.S. has pretty good health care here. So where will they go, and why not to the U.S.?
Jennifer, the main issue with having a facility close to the Democratic Republic of the Congo is if a patient is sick. Again, I'll speak as a heart doctor. I want to take the patient to the OR that's right next door to the room they're sick in, not to the building next to them, or to 3 buildings 2 blocks away, because that time is precious to us. You have a golden hour in many of these instances around trauma, but for illnesses, it's also relatively short. So we are confident, and the State Department's working on this diligently, that they're going to be able to work out something with Kenya. There has already been a fair amount of communication around this issue. We have and that's about it. There's a UK base there. We have other people who might be willing to welcome us, and we have our German colleagues as well. So there's many places we can send folks, but sending them across the world, especially when we're not sure what's going on with them, is probably not the wisest move.
Why the hell is what the US is trying to do with this Ebola quarantine situation in Kenya not making global news? We need to create more awareness immediately, and we need to push back. The US reportedly wants to move around 50 Americans who've been exposed to Ebola in the DRC to Kenya for quarantine. Yeah, I said from the DRC to Kenya. Even though Kenya has no recorded Ebola cases, Kenya's High Court already pushed back and temporarily suspended the plan a few days ago, but reports suggest that preparations appear to continue. Kenyans protested yesterday because they do not want their country used as a quarantine site for foreign nationals while their own court order is being ignored. And this risk matters even more because this particular strain of Ebola currently has no licensed vaccine or specific treatment. Past outbreaks have had fatality rates of around 30 to 50%. And I absolutely want to make something clear to you, yeah? I am so outraged, but I'm trying to actively soften my language in this video so that the seriousness of what's happening doesn't get lost in my emotion. Because fear, panic and noise are not going to help here. The help has to come in the form of action and pressure. This has to be people in Kenya, people in America, people in the diaspora and people across Africa asking very serious questions about how this decision was made, who agreed to it, and why Kenyan people are being asked to carry a risk that they did not consent to. I'm usually very skeptical about awareness campaigns coming out of Africa because too often they turn into noise and create more problems for Africa. But this awareness isn't just for Kenyans. This is for US citizens to apply pressure to their own government because exposed American citizens should not be quietly exported to Kenya as if Kenyans don't have enough on their plate already.
The Kenyan people are fighting back against the United States government. High Court Judge Patricia Nyandi just ruled that the United States is barred from opening their quarantine facility on a military base. And the Kenyan government cannot accept, transfer, or admit anyone exposed to Ebola or experiencing Ebola symptoms. This comes as the Kenyan people were outraged that they would be opening the 50-bed facility with only 3 days of training, while their healthcare system is extremely stretched. 10,000 doctors signed a petition saying that would endanger public health. So overnight, President Ruto and Secretary of State Marco Rubio got on a phone call where Rubio offered him 13.5 million USD for Ebola preparedness efforts. One can only imagine what the Kenyan people will think about that, offering to pay a small amount of money to risk all of their safety. Now this will come up for review on June 2nd, but the Law Society has filed a constitutional petition, and American medical workers are also upset with the decision because it will cause a delay in their care and it increases risk to more people.
A Kenyan judge said no to America's plan to house people who were Americans that got exposed to Ebola in Kenya instead of bringing them to the United States where we have world-class isolation units for people who have Ebola. Now, it turns out in the United States we have several major centers, including at Emory University, including at the University of Chicago, including at almost every major medical center that are specifically designed for very bad viruses like Ebola. We can bring people back to the United States, quarantine them there, watch them, and if they do get sick with Ebola, take care of them safely and effectively here in the United States, where not only do we have infectious disease specialists, but other specialists that can help take care of them and all of the problems that might come with Ebola virus. This is good news for Americans, and it is good news for those who volunteer to go over and help with this devastating outbreak.
Kenya just blocked the U.S. from opening an Ebola quarantine facility for Americans on African soil. Now, the White House had said that that would actually open today, but it's now in limbo. It's supposed to be a 50-bed facility, and for Americans who have Ebola or who have been exposed to the virus, with this outbreak still surging in the Democratic Republic of Congo and in neighboring Uganda to the east, with at least 220 dead and at least something like 900 people infected so far. So what happened in Kenya was that a constitutional watchdog called the Katiba Institute filed this emergency petition. This was yesterday, Thursday, and it said that the government was being reckless and that Kenya was essentially being used as a kind of dumping ground for America's infectious disease fears. Their exact words was that the U.S. was externalizing infectious disease risks to the Republic's territory. And then the judge acted fast, and the order is sweeping. Kenya's government can't open any facilities for Ebola quarantine, for isolation, or treatment that's linked to the United States or to any other foreign government. The Kenyan government now does have 48 hours to respond. The case is already set for June 2nd. And yesterday, Secretary of State Marco Rubio called Kenya's president, William Ruto, and offered $13.5 million towards Kenya's Ebola response. We look ahead to June 2nd to see if that quarantine facility actually gets up and running.
All right, so imagine you're a parent, you got a sick kid at school, the school is calling you to come pick up your kid or whatever, and you just tell them no, keep them there. Do y'all know how crazy that is? That's essentially what U.S. is doing with any Americans that have been exposed or affected with Ebola, because not only did the first doctor that was affected in Ebola in this recent outbreak was shipped off to, Europe to get treatment, the U.S. is trying to set up an agreement with Kenya to be able to have an isolation facility to hold, I think, up to 50 Americans for isolation if they've been exposed to Ebola. Mind you, we have treatment facilities here for that specific purpose. And there's so much of an uproar about this in Kenya that people are actually protesting in the streets about it. So the Kenyan court has filed a block to hold this agreement until more information comes out about it. Not only is this unfathomable, but it plays into the fact that many Americans view Africa as just a dumping ground. Like, we're just there to extract resources and stuff and just dump whatever we don't want. Kind of like, like a trash heap. But yet we expect somebody else's country to pick up the slack and take in our citizens when we probably didn't elect their citizens into our country about this. Like, make it make sense, y'all.